First one is awareness breathing. Hands in Shin Mudra, friends. Hands in Shin Mudra. Spine erect. Close your eyes. Now just observe your breath. You are inhaling. The inhalation breath is coming. It is going deep inside. Then the exhalation starts. Exhalation breath comes out. Just go with a flow of inhalation and exhalation breath. So this is called awareness breathing. This helps to bring awareness to our breath. Okay, hands in Chin Mudra. Keep your eyes closed. Observe your breath for 3 minutes. I will alert you after 3 minutes. Gently open your eyes. Now, today we will be seeing the pranayama for the inflammatory conditions like acidity complaint, ulcer complaint, or PCOD problem or PCOS complaint, like that. Okay. And this pranayama could also be used for the problems like high BP or migraine issues also. So these things represents the elevated pitta dosha. Okay. So the pranayama that we would be doing, it would be helpful to cool down your body or bring back the inflammation and bring back the inflammation to the normal position. Right. Now, the first pranayama that we will be doing is cleansing, Bastrika pranayama. Okay. Actually, Bastrika pranayama is a heating pranayama. Okay. But why we are doing Bastrikana? We are doing it to cleanse our thoracic cavity, pharynx, as well as your larynx. Okay. So, what are the contraindications of Bastrika pranayama? If you are suffering from at present, if you are having elevated BP at present moment, okay, elevated BP at present, if you are having migraine issues, or if you are pregnant, or are you menstruating, so there are strict no-nos, okay. Whereas if you are having the past history of having BP or migraine issues, I suggest doing Bastrika on a lighter note, just to clean the passage here. The nostrils would be blocked, right? When you do Bastrika, it would be cleared up. So there is a word of caution that do Bastrika on a lighter note. Don't over exert yourself. Do little rounds. That is enough to clear your nostril. Okay, so we are doing Bastrika as a purpose of clearing our air passage. Okay, now let us start, friends. Sit straight and tall. Okay, left hand in Shin Mudra. The right hand would be like this. That is, it is called Vishnu Mudra. Hold your index finger and middle finger. Okay. So the movement or closing the nostril should happen only with the right hand. Got it? Now Bastrika first. Close your right nostril. Inhale slowly through the left and exhale forcibly through the left. See friends, if you are currently having high BP, okay, problems like that, then what I suggest now, make use of this mudra. This is Apana mudra. The thumb is touching middle two fingers. Just keep your hands in this mudra, eyes closed, and just make conscious breathing. That's it. Otherwise, now let us move on to Bastrika Pranayam. See, close your right nostril. Inhale slowly through left and exhale forcibly through the left itself. Observe. Got it? Yes, 7 rounds, friends. Start. Now gently open your eyes. Now you have cleared the left nostril. Now we will move on for clearing out of the right nostril. See, close your left. Okay. Inhale slowly through the right. Exhale forcibly through the right itself. Got it? Start. Now relax. Now observe, friends. Now you have cleared the right nostril. Okay. Now we will clear out the passage between the left and right nostril. Okay. Now close your right nostril. Inhale slowly through the left. Then exhale forcibly through the right. Observe. Okay. 7 rounds. Start. Now gently open your eye. Now you have cleared the passage between left to right. Now it's time to clear the passage from right to left. Okay. Now close your left nostril. Inhale slowly through the right. Exhale forcibly through the left. Observe. Okay. 7 rounds. Start. Now gently open. Now it's time to clear out both nostril. Okay. So observe friends. Slow inhale. Okay, forcible and fast exhalation. Okay, the movement of hands has nothing to do with the breathing, but just to indicate that you're inhaling slowly and it helps to create the space to let in more prana shakti come in. Then you exhale forcibly all of a sudden. Okay, now we will be doing for 9 rounds. Observe. Got it? Okay, yes. Shall we move on? 9 rounds. After 9 rounds, don't open your eyes. Keep your eyes closed. Observe what is happening to your breath for few seconds. Start, friends. Gently open your eye. Yes, now let us move on to Apana Mudra breathing. Observe, friends, hands in Apana Mudra. The thumb is touching the middle two finger. Yes, yes. Apana Mudra helps to tone up the functionality of Apana Vayu in the body. Apana Vayu acts here in the lower abdomen. And this Apana Vayu is responsible for descending down everything from our body, also from our mind. So if you are having problem with your elimination of urine, fecal matter, semen, or if you are having irregular periods, you can try Apana Mudra. Okay, so it helps to clear out the things. So it also acts as a cleansing agent. It not only clear out your physical body, but also helps to get rid of your mental baggages, mental impurities also. It helps to eliminate. Okay, so what are the contraindications of Apana Mudra? Pregnant ladies, and if you are suffering from diarrhea complaints, or if you are having heavy bleeding, at present you are going through heavy bleeding in your menstrual cycle, you are supposed to avoid Apana Mudra. Otherwise, you can very well go for doing it. See, hands in Apana Mudra, the thumb is touching the middle two fingers. Keep your palm facing up, keep your eyes closed. Just make conscious breathing for 3 minutes. It is actually very good for high BP ailments. 3 minutes. I will alert you after 3 minutes. Now, gently open your eyes. Relax. Now let us move on to Prithvi Mudra breathing. Observe friends, the thumb is touching the tip of your ring finger. Tip of your ring finger. The tip of the thumb touching the tip of ring finger. This is called Prithvi Mudra. Okay, what do you mean by Prithvi? Prithvi means earth. Okay, see, if there is an inflammation in your GI tract due to acidity or ulcer complaint, what it represents? Your muscle, the GI tract muscle is getting inflamed. Okay, our body is made out of 5 elements. Out of these, the muscles are made out of the earth element. So it represents that inflamed muscles represents that there is an imbalance happening in the earth element. So when you do Prithvi Mudra, it helps to balance the earth elements, thereby healing happen in the inflamed muscle. Other than this, Prithvi Mudra also helps for to take care of your bones, muscle, nail, also the hair. Prithvi Mudra also helps you to stay grounded, and it is also the therapy mudra for insomnia problem. Then this Prithvi mudra also helps for the people who are having the problems like high BP also. Okay. Now, it also helps you to maintain the weight optimally. We don't want to stay obese and we don't want to be so thin. Okay. It helps to maintain a healthy weight in our body, right? Hands in Prithvi mudra. Keep your eyes closed. 3 minutes of breathing. Start. Yes, gently open your eyes. Yes, friends. Now let us move on to Tirumular Pranayama. Okay. See, Tirumular Pranayama is having 5 steps. Okay. Tirumular Pranayama is having 5 steps. Let me explain each and every step. Okay. So the first step, observe, you inhale through the left, exhale through the right. Step 1. You inhale through the left, exhale through the right. This is step 1. Got it? Yes. So in this pranayama, you always inhale through left and always exhale through right. Right? Step 1, inhale through left, exhale through right. This is step 1. Then step 2. Okay. Inhale through left, hold your breath as long as you can. Then you exhale through right. This is step 2. You understand? Yes. Now let us move on to the third step. Okay. Inhale through left. Hold your breath as long as you can. Exhale through right. Again, hold your breath as long as you can. This is step 3. Understand, everyone? Let me repeat one more time. Step 1, inhale through left, exhale through right. Step 1. Step 2, inhale through left, hold your breath as long as you can, exhale through right. Step 3, inhale through left, hold your breath as long as you can, exhale through right. Again, hold your breath as long as you can. This is step 3. You understand, everyone? So each and every step has to be repeated for 5 times. Step 1 has to be repeated for 5 times. Step 2 for 5 times. Step 3 for 5 times. You understand? Batmata Purida? Then step 4. Step 4 is nothing but step 2. Step 4 is nothing but step 2 again. Okay? Then step 5. Step 5 is nothing but step 1. Okay? So we are having 5 steps. Step 1, step 2, step 3, again step 2, again step 1. Okay? So each and every step has to be repeated for 5 times. You have any doubt in this? Any doubt in this? If you have doubts, you can ask me. Okay. So the inhalation always through the left, and exhalation always through the right. Okay. So this is the process of pranayama, Tirumular pranayama. Okay. So what are the benefits of this Tirumular pranayama? It is having wonderful benefits. Okay. It is not simply said, it is researched. We are having a scientist called Sundar Balasubramaniam who lives in USA. Okay, he is a cell biologist. Okay, and he used to practice yoga and pranayama on a regular basis. One day, when he practiced this Tirumular pranayama, he felt that he is salivating. Okay, so he got curious. So he thought of doing research on that. So first, what he did now, he took his normal saliva sample, tested that one. Then he did this Tirumular pranayama. After that, he again took that saliva and tested the saliva sample. Okay. So what he found now, the saliva that is secreted after doing the Tirumular pranayama has contained lots of wonderful protein molecules. First, it had immunoglobulins. Okay. So the immunoglobulins helps to improve the immunity level. Got it? Then it contained the NGF. NGF means nerve growth factor. So these are the factors responsible for repair and rejuvenation of your nerves, also your neurons. Okay, so when we do it on a regular basis, we won't end up in the problems like Alzheimer complaint, dementia problems, all these complaints. And if you are having a poor eyesight, what the doctors would be saying? The optic nerve is weakened, right? So if you want to strengthen your nervous system, you can do this pranayama. Then the next thing, this one is having the protein molecules called DMBT1. Okay, so this DMBT1 molecule is tested for the cancer, prostate cancer, lung cancer, breast cancer. What they will be doing now, they will be testing DMBT1. If the DMBT1 protein molecule is missing, it represents that it is a cancer or a tumor. Okay, so our body is producing its own DMBT1 all by means of pranayama. Okay, so when we do this pranayama on a regular basis, we can stay away from these deadly diseases. Then the next thing, this pranayama helps to decrease the level of cytokines. Cytokines are the things that helps to mediate the inflammation. Or if your body is in an inflammatory condition, when we test, it represents the elevated cytokines level. Whereas when you do this pranayama, it helps to reduce the cytokines level. So the inflammation will come down. Got it? So this pranayama is having lots of wonderful benefit. Okay. Now let us move on to this pranayama. Yes. So the thing is, if you are suffering from depression, Okay, this pranayama tap you into the parasympathetic nervous system that is responsible for repair and rejuvenation. If you are suffering from depression, if you are so introvert, what you can do now, you can stay away from this. Otherwise, you can very well do. And one more thing, just simple inhale and exhale. If you are already proficient with the kind of breathing like this, what you can do now, you can do this breathing with holding, holding and counting, right? See how much count you have to inhale. For example, if you are inhaling for 4 counts, you hold for 16 counts, you exhale for 8 counts, again you hold for 8 counts. The ratio is inhalation, holding, exhalation, again holding. The ratio is 1:4 is to 2 is to 2. 1:4 is to 2 is to 2. That is, if you are inhaling for 4 counts, you hold the breath for 16 counts, then you exhale for 8 counts, again you hold the breath for 8 counts. You understand? You understand, friends? Yes, if you don't want to get into the counting, just inhale and exhale and hold the breath as long as you can. Yes, but ensure that the exhalation is longer than the inhalation. Right? Shall we move on? Yes, friends, 5 steps are there. Each and every step has to be done for 5 times. Yes, let's start. Left hand in Shin Mudra, the right hand is like this. Start.
இப்ப ஃபர்ஸ்ட் ஸ்டெப் வந்து 5 நிமிஷம் செய்யவா?
5 நிமிஷம் இல்லம்மா, 5 தடவை. இடது பக்கம் நாசியில எடுத்து வலது பக்கம் விடுறோம். இடது நாசியில எடுத்து அது மாதிரி 5 தடவை. அது மாதிரி ஒவ்வொரு ஸ்டெப்பும் 5 தடவை செய்றோம். சரியா?
ஓகே.
Yes, gently open your eyes. So, how it is? See, have anyone entered the class with hunger in your abdomen? Anyone? When you entered the class, you felt hungry? Yes, or before doing the pranayama, you felt hunger in your abdomen? So when you observe, friends, when you are very hungry, okay, that time when you do this pranayama, you can observe that within 5 minutes of time, the hunger tends to decrease. I'm not saying that hunger is bad. Hunger is actually very good. If and only if you feel the hunger, it means that you are alive. Okay. But what this represents now, this pranayama helps to decrease the false hunger. False hunger in the sense, sometimes we would be liking to munch on everything all the time, right? We know that junk food is bad. Okay. But what we do, we usually crave for junk food only, right? All the times. So it helps for the people who want to come out of the junk food addiction complaint. Then there will be some people who like to munch on all the time. And if you take the diabetic people, okay, if you take diabetic people, all the time they would be feeling hungry. All the time they would be like to, they won't eat much, they will eat this much only, but they like to eat little like that. Okay, so it is very good or very beneficial for the people who are having diabetic. Okay, whereas it's a word of caution that this pranayama helps to lower your temperature. Okay, so you have to watch out for the external environment also. You don't practice this pranayama when you are in high altitude, when you are in a hill station, or if the outside temperature is very much freezing cold, and if the snowfall is happening like that, outside environment is already, it is very cold. In such a case, when we do this pranayama, again it would lower our body temperature also. Then the next, one more thing, if you are going more introvert, you are not talking to any people, okay, you are being so depressed, in such a case also, you just observe your signs and go for it. If you are having acidity, ulcer, heartburn, high BP ailments, you are becoming so ambitious in your thoughts, so ambitious, so very much excessively ambitious in your work. You are getting angry all the time, frustration all the time, irritated all the time. In such a case, you can do, but you are not having any of these conditions. You are becoming so introvert, so depressed. That time you can watch out for these things, and you need not do this pranayama like that. Yes. And if you are having the problems like asthma or asthma complaints, or cold, seasonal flu, something like that, sore throat, that time also our body is already cold. That time you can stay away from this pranayama. Got it, friends? Yes. The next one is Ujjayi breathe. Okay. So keep your hands like this, your palm facing up. Okay. Now observe, you have to inhale and exhale out through your mouth only. Ensure that the inhalation breath is touching here the throat, inner part of the throat, and the exhalation part also, the breath also touch the epiglottis, the inner part of the throat, and comes out. Okay. And when you do so, what happens then? The inhalation and the exhalation breath resembles the sound wave of the waves rising up and the waves falling down in the ocean. Observe, let me show you how to do that one. I'm inhaling. Am I audible? Am I audible? I'm not audible. Am I audible now? Can you hear the sound? Yes? You hear the sound? Yes? No. Yes, friends. So it's not audible, right? See, the breath should touch your epiglottis and it has to go in and come out. That's it. Okay. When you do so, it would resemble the sound of the waves rising up and falling down. That's it. Okay. Now we will be doing, keep your palm facing up. சொல்லுங்க அனுராதா.
இன்ஹேல் அண்ட் எக்ஸேல் ரெண்டுமே மவுத்ல தானா?
ரெண்டுமே மவுத்ல தான். Keep your eyes closed and you have to visualize. When you inhale, just visualize that waves rising up. When you exhale out, just visualize that the waves are falling down in the ocean. Okay, visualization is also important. Now we will be doing for 9 rounds of breathing. Start. Yes. Observe your throat. Do you feel the coolness in your throat? Are you salivating? Yes. So this saliva secretion is much important as researched by the Sir Dr. Sundar Balasubramaniam. And this represents the coolness in your throat represents that your body is getting cooled down. Okay. So the caution for the step 1, since you are inhaling through the mouth, don't do this step 1 if the place is highly polluted, air polluted. Okay, you are living in the mid of the city and it is very highly polluted. In such a case, don't do step 1 because when you inhale through nose, lots of hair follicles will be inside the nose to filter out the air. Okay, whereas when you inhale through the mouth, nothing is there. No kind of filtration would be happening here. So if the air is very highly polluted, what happens? You will end up in sore throat complaints. Okay, so ensure that the place is so clean and it is not getting polluted, right? Then step 2. Now close your ear with the index finger. Okay. Now you are inhaling through the nose, exhaling out through the mouth. The same breathing, the inhalation and exhalation breath touch your inner part of the throat, the epiglottis, and come and go out. Same visualization. But you are inhaling through the nose, exhaling through the mouth. Got it? 9 rounds. Observe everything. What is happening to the earlobes? Observe. Gently open. How are you feeling now? Have you observed your earlobe? Do you feel any kind of chillness happening in the earlobes? Yes? Yes. So observe that one. Then step 3. Okay, step 3. The same breathing, same visualization, but you are inhaling through the nose, exhaling out through the nose only. Okay? 11 rounds. Again, observe what is happening on your ears. Start. Yes. Now also you feel the chillness in your earlobes here. So this represents that you are working on your kidney and adrenaline glands. Your adrenaline gland is responsible for the cortisol production that makes you more sympathetic. Okay. So when you do this pranayama checks with the cortisol production that helps to calm down your mind instantly. So this pranayama is totally safe. You can practice this even before going to sleep also. When you do this pranayama, the sleep will be good. The quality of sleep would be good. We won't end up in the problems like dreamy sleep or the insomnia problems. Sit in the bed, do this pranayama and directly drift off to sleep. Yes, friends? Yes. So you have any doubts regarding this? Now, what we have done now, we have cooled down our system. Okay. Now, whether you are joining from India, சொல்லுங்க அனுராதா.
மேம் இப்ப இந்த உஜ்ஜாயி வந்து 3 ஸ்டெப்பா மேம் டோட்டலா இது 3மே உஜ்ஜாயி தானே மேம்? ஃபர்ஸ்ட் நோஸ் வாயில வந்து எடுத்து வாயிலே பண்றது, நோஸ்ல இருந்து எடுத்து வாயில பண்றது, நெக்ஸ்ட் நோஸ் டு நோஸ். இது 3மே உஜ்ஜாயி. 3த்துலயுமே வந்து 9 ரவுண்ட்ஸ் பண்ணணும்.
ஆமா. 9 ரவுண்ட்ஸ் நான் சும்மா மினிமம் நான் சொல்றேன். உங்களுக்கு எவ்வளவு ரவுண்ட்ஸ் சிஸ்டமோ நீங்க பண்ணிக்கலாம். எவ்வளவு நாளும் பண்ணலாம். ஒண்ணுமே பிரச்சனை இல்லை. Okay.
ஓகே.
So whether you are joining from India or from abroad also. Okay. So if you are joining from India, you are going to have your breakfast, right? If you are joining from abroad, you are going to sleep. For whatever the thing, you need sleep in your body. But what we have done as a therapy, we have cooled down our system, right? Now you need sleep in your, for eating, you need the Jatara Agni, and for sleeping also, you need the fire element. Okay. So now what you are doing now, you are relaxing, lying on your left side. Okay. So lie on your left side, that is the left armpit is down. Lie down like this. Everyone, lie down like this so that the left armpit is down. Lie on one side, lie on your left side. Yes, keep your eyes closed. Left armpit is down. Keep your eye closed. Stay for 3 minutes. Now, slowly inhale, rise up. Please rise up, everyone. Now you can check your breath. Just in which nostril your breath is much active or stronger. Just inhale and exhale through the left and inhale and exhale through the right. Which side it is active or stronger? It should be your right side. Just check. Your right side breath should be stronger than the left. Is it? Yes. Yes, so the right side is stronger. So we have activated the Surya Nadi. Right nostril is active. Then it would take care of your sleep, hunger, and digestion. Yes, yes, friends. Now let's finish off the session.